Cholesterol is essential for life. Every cell membrane in your body relies on it for the right balance of fluidity and structure. It's not just a structural component. Cholesterol is the starting point for steroid hormones, bile acids, and vitamin D. Hormones like cortisol, testosterone, and estrogen all begin as cholesterol, regulating stress, blood pressure, and reproduction. Your liver converts cholesterol into bile acids, which help digest and absorb fats. Sunlight turns a cholesterol derivative in your skin into vitamin D, vital for strong bones and immunity. So, cholesterol is a building block for structure, communication, and digestion. The real issue isn't cholesterol itself, but how it's transported and managed in your bloodstream. Without cholesterol, cells would be too rigid or too flimsy to function. It acts as a buffer in cell membranes, adapting to temperature changes. Cholesterol's derivatives are crucial for hormone production and fat digestion. It's not the villain problems arise only when its transport goes awry. Understanding cholesterol's roles is key to understanding its impact on health. Your liver is the main factory for cholesterol, using acetyl-CoA as the starting material. The key control point is the enzyme HMG-CoA reductase. This is where statin drugs act to lower cholesterol. When cholesterol levels are high, the cell shuts down this enzyme, slowing production. This feedback system keeps cholesterol in balance. No waste, no excess. High cholesterol not only inhibits the enzyme but also reduces its production and speeds up its breakdown. This multi-level regulation ensures your body makes just enough cholesterol. The process is tightly managed to maintain homeostasis. When the system fails, cholesterol levels can rise dangerously. That's why understanding this pathway is crucial for medicine and health. Cholesterol and fats can't travel alone in watery blood. They need transporters called lipoproteins. Lipoproteins are like biological submarines with a fatty core and a protein-laden shell. Special proteins, apolipoproteins, act as shipping labels, guiding lipoproteins to their destinations. There are several types: chylomicrons, VLDL, LDL, and HDL, each with a unique job. The more protein, the denser the lipoprotein. HDL is the densest, chylomicrons the least. Chylomicrons and VLDL carry triglycerides, LDL carries cholesterol to tissues, HDL brings cholesterol back to the liver. This system ensures fats and cholesterol reach where they're needed or get cleared away. Understanding these carriers is key to understanding cholesterol's impact on health. Good and bad cholesterol refer to their carriers. LDL and HDL, not the cholesterol molecule itself. LDL delivers cholesterol to tissues, but too much leads to plaque buildup in arteries, atherosclerosis. Excess LDL gets trapped, oxidized, and triggers inflammation, forming dangerous plaques that can block blood flow. That's why LDL is called bad cholesterol. HDL does the opposite. It picks up excess cholesterol from tissues and arteries, returning it to the liver for disposal. This reverse cholesterol transport helps prevent plaque buildup. HDL is the good cholesterol. Higher HDL means lower cardiovascular risk. Remember, LDL leaves cholesterol behind, L for lousy. HDL helps remove it, H for healthy. The balance between LDL and HDL is more important than total cholesterol alone. Too much LDL or too little HDL tips the scale toward heart disease. Managing this balance is crucial for vascular health. That's the real cholesterol story. Hyperlipoproteinemia means too much fat, cholesterol, or triglycerides in the blood. Causes can be genetic, like familial hypercholesterolemia, FH, or lifestyle-related, like poor diet and inactivity. FH is a genetic defect in the LDL receptor, causing sky-high LDL and early heart disease. High LDL leads to plaque in arteries, causing heart attacks, strokes, and peripheral artery disease. Extremely high triglycerides can trigger pancreatitis, a dangerous inflammation of the pancreas. Managing both cholesterol and triglycerides is vital for preventing these complications. Low lipoprotein levels are rare, but can cause problems with vitamin absorption and nerves. Identifying the cause is key to effective treatment. When lifestyle changes aren't enough, medications step in. Statins are the top choice. They block HMG-CoA reductase, lowering cholesterol production and boosting LDL clearance. Fibrates target high triglycerides by activating enzymes that break them down. Bile acid sequestrants bind bile acids in the gut, forcing the liver to use more cholesterol to make new ones, lowering blood cholesterol. Ezetimibe blocks cholesterol absorption in the intestine, often paired with statins for extra effect. PCSK9 inhibitors are powerful new drugs that prevent the breakdown of LDL receptors, further lowering LDL. Statins cut production, fibrates clear triglycerides, resins and acetamy block absorption, and PCSK9 inhibitors protect LDL receptors. Each class targets a different step in cholesterol management. Knowing these mechanisms is key for treatment and for acing your exams. The right medication depends on the patient's specific lipid problem.